Continuing our My Health series today, we have a topic that understandably may be a little uncomfortable for women to discuss, their pelvic health. In fact, moms, our discussion may not be appropriate for some children, so please be advised. As difficult as it may be to discuss, millions of women suffer from conditions that affect their pelvic health. Today, we're going to learn about two of the most common conditions: stress urinary incontinence and another equally disruptive condition known as vaginal prolapse. Now, to help us better understand both of these problems, we have with us a urologist from Metro Urology in Minneapolis, Minnesota. And a little bit later, we're going to meet a woman affected by this problem and how she dealt with it. But first, please welcome Dr. Suzette Sutherland from Metro Urology. Good morning, doctor.
Good morning. Thank you. It's a pleasure to be here.
Oh, no, thank you so much for being here. Now, the two conditions, again, stress urinary incontinence and vaginal prolapse. Let's start with SUI. What exactly is that?
Well, that's any involuntary leakage that happens. So whether it's with a strong maneuver that puts pressure on the abdominal area and there's not enough strength from below, and so that physical stress causes the urine to leak out.
How common is it? I mean, is it age-related?
Oh, it's very common, and it can be age-related. We certainly see the incidence increase as women age, but about 1 in every 3 to 4 women over the age of 25 to 30 actually suffer from this problem. So it's not just a problem associated with aging.
Much more common than I thought.
Absolutely.
What are some symptoms? How would I know?
Well, specifically, after a strong cough, a sneeze, maybe jumping up and down, there's a little bit of leakage that happens at the moment that pressure increases. So we're talking about physical stress.
Are there things that women can do to deal with SUI?
Well, certainly wearing some panty liners, especially at the time of exercise, maybe watching a few things as far as dietary maneuvers are concerned, but predominantly if a woman isn't able to recreate the support herself, which you do that through Kegel exercises, those are those muscle exercises, you squeeze those pelvic floor muscles.
Sure.
So if she can't correct the problem herself through that, then the surgeon recreates the support for her.
So doctors are able to assist. What kind of surgical option are we talking about here?
Well, the most common procedure that's done today for this problem is called the mid-urethral sling, recreating a little support under the urethra. There are a few other procedures that can be done as well, aren't done quite as commonly today, recreating support at the bladder neck or adding a little bit of injection around the urethra to bulk that area up. But again, most commonly it's called the mid-urethral sling.
Okay, and when you talk about this sling and this mesh, explain that to me, because I've never heard of this.
It's a little piece of mesh. It's polypropylene, so it's an artificial piece of material that sits underneath the urethra. If I can demonstrate with my hand, my finger is the urethra, the tube where the urine comes out, and here's my bladder, is my fist.
Okay.
And if you've lost some of the support underneath the urethra, when a woman coughs or bears down, that urethra moves. And we place a little piece of mesh underneath the urethra to recreate that support. So now with that stress maneuver, the urethra has something to bear down against.
Interesting. And can you show me the mesh? Do you have an example of it?
I do have a piece of mesh right here. Again, it's a piece of artificial material. You can see how small that is.
Oh my gosh.
This is one of the newer it's called the mini arc, or a single incision sling, so it's much smaller than some of its earlier prototypes.
It's so small. Now, this can be an outpatient procedure?
It can be. Most commonly it's done on an outpatient basis and with a little bit of IV sedation. So the woman goes home the same day without a catheter, and the procedure itself can take up to 10 to 15 minutes to do.
Okay, interesting. Now let's move on to vaginal prolapse. Explain that to me, and how does it differ from what we were just talking about with SUI?
Well, vaginal prolapse again involves the lack of support, but now it's in the whole vaginal area, or at least a larger part of the vaginal area.
I see.
If it's in the front of the vagina, what's behind that is the bladder.
Correct.
And so the bladder can come drooping down. If it's in the back, it could be the rectum, the top could be the uterus, or in the case of a hysterectomy, just the top of the vaginal canal. If it's coming down such that it's coming out of the vaginal canal, the woman certainly notices it,
Sure.
has symptoms, and that's the problem. If it's not coming all the way out, then usually it can be an asymptomatic issue where the woman doesn't even know about it and doesn't necessarily need treatment for that.
But is there treatment, if you will, for this?
Oh, yes, and the treatment for that really predominantly is surgical treatment, because if the prolapse is coming all the way out, no amount of exercises are really going to recreate that support. It needs to be done surgically. But again, it can be done a variety of ways, but also some transvaginal ways, and where a woman stays overnight in the hospital just on observation. So it's not a big, elaborate hospitalization.
Great information, doctor. Now, stay with us for just a few more minutes. Obviously, it sounds like there are some things women can do to improve these conditions. And by the way, when we come back, we're going to meet one of these women, and she's going to share her insights on stress urinary incontinence and how she restored her body and her confidence. So we'll be right back. Welcome back, everyone. We've been learning about two of the most common pelvic health conditions for women: stress urinary incontinence and vaginal prolapse. And again, moms, a heads up, our discussion may not be appropriate for young children. Joining us now to share her story is a woman who was diagnosed with SUI. We appreciate her sharing her experience with us today, and we want to welcome Rachel Kozar, along, of course, with Dr. Sutherland, who remains with us. Good morning, Rachel.
Good morning.
Thank you for being here. And, you know, thank you so much for opening up, because it's obviously not something that you really want to talk to an audience about, but you're here to share your story and tell me about your experience.
You know, after the birth of my second child, I was 32 years old, and I just found that I was leaking with such simple things as sneezing or a cough, and especially with exercising, running and lifting heavy weights. I found that I was leaking, and I just knew it wasn't right. Mm-hmm. And I was really concerned about it.
And I'm sure it was difficult for you, because you're probably thinking, I'm 32 years old. What is this, right?
Exactly. So I knew that I needed to go see a doctor who specialized in female urology and find out what my options were.
Kudos to you, Rachel, because, doctor, I was amazed here. Look at this. 15% of women with SUI actually seek treatment, which means the other 85 just live with it?
Exactly. And that's a big part of that is the problem, is that women just think that this is something that they need to deal with. They had a few babies, and my mom leaked, my grandmother leaked, but there are simple things that we can do today to solve that problem. So my message is, if it impacts your quality of life, then you should do something about it. Don't wait until it gets very terrible before you do something about it.
Absolutely. So tell us what you did, Rachel.
So I ended up having the mini arc sling procedure, and it was a great success for me.
A lot of women, like, the first thing I'll think of is, okay, I'm glad you did the procedure, but I'm one to say, oh, I don't like doing procedures, I don't want to go to the hospital. Recovery. Can you tell us about your recovery?
It was an outpatient procedure. I had it done on a Friday, and I was back to work on Monday.
Oh, wow. Simple enough. Now, tell us how it's changed your life, because I could tell it had an impact, and it worried you a lot.
Right.
Where are you today?
Well, it changed my life in so many ways. I'm just more confident. I don't have to think twice about going out for a run. I stay dry. It just has been a positive experience overall, and even training now for a triathlon this summer.
Good for you, a triathlon. Wow, you go, girl. Doctor, maybe some advice for women out there who are suffering from SUI and are living with it and saying, I'm just going to live with it. What would you say?
That they shouldn't live with it. I mean, if it's a problem that's perceivable to them, they should do something about it. And the fact that we have such easy solutions today, there's no reason that there should be a lot of apprehension about having some of those procedures done. So they really need to go out and find somebody who does work in this area and that can solve their problem for them.
Doctor, thank you so much for joining us this morning and giving us all this great information that I wasn't even aware of. And Rachel, thank you so much for opening up. I really appreciate you sharing your experience, and good luck in that triathlon.
Great, thank you.
I've never even done one, so I'm going to call you and see how you did. Thank you again. And for more information on either stress urinary incontinence or vaginal prolapse, two very helpful websites are solutionsforurinaryincontinence.com and solutionsforvaginalprolapse.com. Be sure to check them out.